Hello, Mr. Jones. My name's Emily. Today I want to talk to you about hypertension. There are actually three kinds of hypertension that I want to discuss. There are primary hypertension, secondary hypertension, and complicated hypertension. Primary hypertension is the most common type of hypertension. It is hypertension that develops over time, usually as a result of your diet, your lifestyle, genetics, stress. We have secondary hypertension, which is hypertension that is caused by an underlying health condition that you have. And then we have complicated hypertension, which is uncontrolled hypertension over a lengthy period of time, which then starts causing organ damage, other organ damage. So I was reviewing your chart and your history, and I see that you have a lot of contributing factors for hypertension. So first, you have a family history with both parents passing with the diagnosis of hypertension. You yourself have had hypertension for a period of time. Your job is a high-demand job as a police officer. And then as far as your lifestyle goes, you report that you have daily alcohol consumption, several drinks in a day. You don't follow any routine diet with no monitoring of any type of sodium intake or carbohydrate intake or anything like that. And then there's really not a regular exercise routine that you have other than what is required by your job. So with hypertension, without having it controlled, other things can start to go wrong, other conditions can develop. So one of those conditions, which is one of the more serious conditions I wanted to talk to you about, was left ventricular hypertrophy. And I bring this up because you mentioned that you have recently became short of breath with exertion and activity. So with this condition, it's when your blood pressure has been high for so long, your heart's working overtime, so your heart muscle begins to thicken. And as it thickens, it stiffens and it doesn't pump as effectively and efficiently. So you don't get that blood flow out to your organs and you don't have that oxygen that you need, which then can make you short of breath with minor activity. So with looking at the big picture for you, yes, you have a genetic history that may be contributing and causing hypertension, but there's a lot of things that you can do to kind of help better manage this. So first I would start with monitoring your diet, making some healthy food choices, limiting your alcohol consumption, increase your exercise routine, get some kind of daily walk in, start slow and work yourself up. And over time, monitor your blood pressure regularly and then see if your numbers start to improve with those changes.